Hello and good evening to all of our friends and family of the brothers of the Second District of the mighty Second District of Omega Psi Phi Fraternity Incorporated. I want to say good evening. My name is Brother Kelvin Ampofo, and I am the immediate past. The brothers understand I am the immediate past Second District representative of the greatest fraternity on this side of glory. We are here for our monthly health and wellness webinar, and I certainly want to thank you for joining us on this evening. We have a special treat for all of you as we celebrate Kidney Awareness Month. And so I certainly look forward to the program. As always, any information that you hear from the doctors on this evening, it is the opinion of those doctors and does not reflect the Omega Psi Phi Fraternity Incorporated or the entities that these doctors may be affiliated with. So certainly want to say hello, welcome, and greetings again. I want to right now in advance salute everyone that's celebrating a birthday in the month of March. Also, we want to salute all of our women as we celebrate Women's Appreciation Month. And so with that, let us start off with our second district committee chairman. And as always, we salute our Grand Brossless, Brother Ricky Lewis, and our second district representative, Brother Del Rico Gales, who lets us do everything. So as far as our second district chairman, Brother Dr. Jedan Phillips, good evening, good brothers. Good to see you. Certainly, we'd like to hear your opening remarks at this time, Dr. Phillips.
All right. Good evening, brother. Immediate past. As you said, it ain't no better past than the immediate past. But excited to be here today. Today I had a long day at work, so glad I got done in time to be part of this incredible conversation. Unfortunately, kidney disease is a big problem in our community. So I think it is important for us to hear the message that is going to be given so that we can take the steps that are needed to protect ourselves. If we do already have kidney issues, make sure we're doing the right things to stay on top of it. Because again, we don't want anybody to get to a point where they need dialysis or a transplant. And these things are very, very likely to happen if one is not on top of their medical conditions. So again, brother, immediate past, I'm excited for the conversation that we're going to be having this evening. Thank you.
Thank you so much, Dr. Phillips. As always, we salute you. As you know, you and your team been with us since day one as we started off talking about this pandemic of COVID-19. But now as we move past that, we're talking about health, wellness, and health awareness. And so we want to make sure everybody has the information. Thank you so much, Dr. Phillips. Certainly, let's move to our next doctor, Dr. Boykin. You all know him as a pediatrician, former retired pediatrician. He always makes sure that we have the latest and greatest information as it relates to stats and making sure that our kids are well prepared to deal with everything that's happening in the world. Dr. Boykin, good evening to you, my brother. How are you? Just make sure you come off mute so we can hear all those great things you're telling us, Dr. Boykin, and it's so good to see you.
Sorry about that. Good evening, everyone. And again, welcome to all our regular guests and welcome to our new guests as we progress from the COVID pandemic, as Brother Ampofo said, to our new preventative health series. As you know, I am a pediatrician for a number of years and have also been trained in internal medicine. And I will tell you that, as I said many times before, there are certain diseases that are no respect of a person, and kidney disease is certainly one that doesn't care how old you are, because any age can be affected by kidney. So I want you to sit back tonight and enjoy this presentation because we have a lot of information we want to bring to you, and we have some information that be near and dear to a lot of you already. So again, welcome everyone, and I look forward to having a good conversation tonight with you.
Dr. Boykin, as always, we appreciate you always keeping us in check, always giving us those stats, and we appreciate you, Dr. Boykin. Thank you so much. Now, ladies and gentlemen, like I said, we have some special guests with us this evening as we are obviously looking forward to hearing the importance of kidney awareness. Certainly also want to take the time to thank all of our brothers and sisters of the National Pan-Hellenic Council that have joined us this evening. So we salute all our brothers and sisters of the Divine Nine that are with us tonight. So with that being said, I'm going to introduce a special guest. Ms. Deanna is going to get us started with the National Kidney Foundation, give us a little bit of information as it relates to the National Kidney Foundation, and then she's going to introduce an additional special guest we have with us on tonight. Deanna, good evening. It's so good to see you. Thank you so much for joining us. And we're looking forward to everything that the National Kidney Foundation has to share with us on this evening. How are you?
I'm good, Mr. Ampofo. How are you?
I'm doing well. Thank you so much.
Great. Well, thank you, Mr. Ampofo, Dr. Boykin, Dr. Phillips, for inviting the National Kidney Foundation on this webinar. We are honored to be here with all of you this evening. This is the district that started this wonderful partnership journey between Omega Psi Phi Fraternity Incorporated and the National Kidney Foundation. So we are glad to be presenting this information for your health and benefit to hopefully help you have healthy kidneys and just overall health. So it is my honor to introduce my colleague and friend, Lorna Hankins, who's going to share some important information with you about kidney health. Lorna currently serves as our VP of Community Inclusion and Partnerships for the organization. It's a new position here at the National Kidney Foundation, and we are thrilled to have Lorna serving in that position. She's been with us since 2015 and has served as the immediate previous executive director down in the grand state of Texas. So please welcome Lorna, and the floor is yours.
Thank you so much, Deanna, and thank you to the second district for having us here. And I do have to agree with you that immediate past is great. It's a great feeling. But I'm excited to be here tonight to represent the National Kidney Foundation and talk to you about kidney disease and kidney health. So what's important about tonight is the information that we're going to share. But we also want to make sure that there's going to be an opportunity to address your questions. I know that questions and comments will arise as we go through this program tonight. So why don't we go ahead and get started? Next slide, please. Next slide. Yes. And so you've heard already that we are a volunteer nonprofit health organization that relies on volunteers just like you to help fulfill our mission. And so tonight, I want to later on in the presentation share some of the resources that the National Kidney Foundation provides, but I wanted to just go ahead and jump into the presentations. And like I said, we'll come back to this. Next slide, please. So before we get started, one of the things that I always like to do, and this is something that you can do internally, individually, is just to think about these questions, because this is going to guide our conversation tonight. And at the end of this, we're going to come back to these very same questions. And hopefully, if you didn't have information or if your answers were one thing at the beginning, we certainly want to make sure that those answers are positive as you have listened throughout this presentation tonight. So some of those things that I'd ask you to consider is whether or not you know what your kidneys do. Do you know anyone with kidney disease? Do you know anyone on dialysis? Do you know anyone who's had a transplant? And do you know of anyone who has actually donated a kidney? So keep those things top of mind as we go through this presentation. Next slide, please. So this is the one slide. This is my favorite slide in this presentation. And if you don't remember anything else that you hear tonight, I want you to remember these statistics that I'm going to share with you, because they are, many of them, very startling, and I hope that they will compel you to go ahead and get tested and find out what your kidney health status is. So for example, did you know that 1 in 3 adults is at risk for developing chronic kidney disease? And that's roughly 33%. We're going to talk a little bit later about our Are You in the 33% campaign. But again, I want you to think about that. Are you one of those? Are you one of those who is at risk? 1 in 7 American adults has kidney disease. Startlingly, most of them don't even know it. So if you were to look around the screen, if you looked in your family, you look amongst your colleagues, that is the statistics that's going to be front of mind, that 1 in 7 has kidney disease and don't even know it. So kidney disease also is the 9th leading cause of death in the United States. I know that's surprising to many people. It's a very serious problem. It is more fatal. Kidney disease is more fatal than breast cancer or prostate cancer, diseases that most of us know much more about. But the good news is that early detection and treatment can slow or even stop the progression of kidney disease with simple things like diet change, physical activity, medications that can make a huge improvement. You're going to hear a lot more about those things as we move through this evening. Next slide, please. So again, what we're going to learn today are answers to those questions that I posed at the beginning. What kidneys do and why they're important to your health, what chronic kidney disease is and what happens when you have it, and what can you do about it, who's at risk again, we've already talked about that, and also why kidney disease is an unrecognized public health problem and what you can do to help address that and why you should even care in the first place. Next slide. Okay, kidneys, we just learned that they are very important. They're very important to the functioning of us as human beings. So here's some things that you might want to know. Most of us have 2 kidneys. Each kidney is the size of a fist. If you were to ball your hand into a fist, that's about the size of your kidneys. They weigh each about 5 ounces, and they're located near the middle of your back, just below your rib cage. And one healthy kidney, and this is very important to know, one healthy kidney can do the work of 2, which is great news. It's great news for those waiting for a kidney transplant. We're going to hear more about that later. Most people know a lot about their heart and their lungs and their brain, and of course those organs are critically important. But the kidneys are playing a big role in keeping them working right, properly. The kidneys really help keep all of your body's systems in balance. So let's talk about a few of the things that the kidneys do. They remove waste product from the body, cleaning and filtering your blood, and turning waste products into urine. This is the job of the kidneys that most people are familiar with, but that's not the only thing that kidneys do. Kidneys also balance minerals and pH, acidity of the blood. Our kidneys regulate the levels of minerals and chemicals that are in our body to ensure, again, that our organs and our muscles are functioning properly. You probably already know that your body needs a pretty specific amount of minerals in the blood to keep your heart and your muscles functioning. Things like potassium, phosphorus, and calcium. Well, the kidneys help balance the body's fluids. They remove that excess fluid again when your body has more than it needs, and it holds on to those fluids when you aren't taking enough in. They also keep our bones healthy by activating vitamin D. They produce a hormone that helps keep blood pressure under control. And we're going to talk about blood pressure because that's a critical component in these conversations. And they also produce a hormone that tells your bones to make red blood cells. And these are the cells that bring oxygen throughout your body. So you can see that the kidneys are doing a lot of work for your body. Probably, again, more than you ever realized. Next slide, please. So how do kidneys work? Well, let me just say up front, I am not a medical doctor. I know that we have some who are on, and I would love to be able to hear from them at the end of the presentation. So this is not a biology class. Just want to give you some basic information so that you can understand how your kidneys work. So essentially, a healthy kidney filters toxins, we talked about that already, and waste from our bloodstream. And this is an analogy that I hope that you embrace and think about as you think about what kidneys do. And I ask you to compare the functioning of your kidneys to that of a coffee filter. So you know that when you make coffee, the filter keeps the coffee grains inside, but it allows the water to pass through. Well, your kidneys do something very similar. They keep the things that you need inside your body, but filter out those things that you don't really need. The coffee in your coffee pot is the clean blood sent back into your body. And those grounds, those crumbly, ugly grounds, are the waste products that are sent to your bladder in the form of urine. So essentially that is, it is a very basic discussion about how your kidneys work. But again, I think that coffee filter analogy can help you think about that in a different way and one that's easily understood. So next slide, please. So now that we know what kidneys do, we have to talk about kidney disease. So you learned what a healthy kidney looks like, what it does. So let's talk about kidney disease and let's define that. What is chronic kidney disease, which is also called CKD, kidney disease, or sometimes even renal disease? And this is a term for any conditions that damage your kidneys and decrease their ability to filter blood in the way that they should. So remember that coffee filter analogy we just talked about from the last slide. So now I want you to imagine that that coffee filter gets holes in it. And now you're getting coffee grounds into the coffee pot. This is similar to what happens to our kidneys when we have kidney disease. Over time, our kidneys become less able to filter out waste from our bloodstream, which can cause that waste to build up. Because the kidneys do more than filter out waste, just as we talked about, kidney disease causes more problems than just waste product beginning to build up. High blood pressure and other heart problems can develop. More people with kidney disease actually die from heart disease than from kidney failure. So among other problems, people with kidney disease can develop bone disease or weakened bones because the kidneys aren't able to activate that vitamin D as they did before. People can develop anemia, a low red blood cell count, again, because the kidneys are not producing enough of the hormone that signals the body to produce those red blood cells. And these problems may happen slowly over a very long period of time. Your kidneys have a lot of extra capacity, which is one of the reasons why people can donate a kidney and still lead a very healthy life. It also means that there can be a good amount of damage to your kidneys without any outward signs. And so unfortunately, even when there are no outward symptoms, there are problems going on inside your body. Problems like we talked about, high blood pressure. So chronic means that the condition does not go away, but there are treatments. There is no cure for kidney disease. Eventually, especially if no action is taken, kidney disease can lead to kidney failure. And at that point, another treatment is needed to keep you alive. And we'll talk more about what those options are later. Next slide, please. Are you in the 33% campaign? We talked about this a little bit earlier on, and you're going to hear a little bit more about it later and actually get the link for you to take this risk assessment quiz and find out if you do have any risk factors for kidney disease and what you can do about that. So one of the questions that we ask and that you should consider as well is whether or not you have diabetes. Or even pre-diabetes. Diabetes is the leading cause of kidney failure. If you have diabetes or even pre-diabetes, which means that you are at high risk of developing diabetes, you are at risk for developing kidney disease. Other things to ask, do you have heart disease or heart failure? Your heart and your kidneys are very closely linked. And if you have heart disease, it can damage your kidney. Or if you have kidney disease, it can damage your heart and your blood vessels. Another thing to ask, do you have high blood pressure? And we know that this is an issue in our communities. Or do you take medicine for your blood pressure? Uncontrolled or poorly controlled high blood pressure is the second leading cause of kidney failure. So ask yourself, do you have high blood pressure, and what is it that you're doing about it? Has anyone ever been diagnosed with kidney failure? Have they had a kidney transplant or been on dialysis? This is the kind of question, these are the kinds of questions that you need to be asking as you assess your own individual kidney health. Other things, are you over 60 years of age? Are you overweight or obese? Again, all of these questions that will give you insight into your predisposition for CKD. Next slide, please. We already talked about diabetes and high blood pressure as being the two leading causes of CKD. So we can go ahead and let's move to the next slide because, again, I want to make sure we have time for questions. And the next slide just talks about the connection between COVID-19 and kidney failure. What we found was that people with kidney disease and other severe chronic medical conditions were at a higher risk, and I guess certainly still are at a higher risk for more severe illness from COVID-19. Next slide, please. So you've heard all of this information. I hope that you've internalized it. I hope that it's caused you to start thinking about yourself and your family. So now the question becomes, what can I do about it? And that is the value in presentations like this tonight. There are things that you can do to ensure that you lead a healthy life based on your assessment of your health and what you choose to do about it. So if you have any of those risk factors that we talked about, and again, you know this, the statistics, you need to get tested. And so one of the things that people question that they wonder about, well, is that testing, is that extensive? Is it complex? And whether or not it is expensive, and is it hard to get? There are two simple tests that I want you to remember for kidney disease, and that's a urine test and a blood test. The urine test, called ACR, is a test that checks for excess protein in your urine. It is quick and it is painless. eGFR is a blood test that uses the amount of creatinine, which is a waste product, in your blood to measure your level of kidney function. Your doctor can help you calculate that and, of course, give you a roadmap to follow in order to, again, ensure your chances for an optimally healthy life. I wanted to just mention here very quickly a change in the eGFR calculation. The use of a race multiplier, which required inputting whether or not a patient was African American or non-African American, has come under increasing scrutiny for a while for its lack of recognition that race is a social construct. It is not a biologic construct. And spurred by worries that the modifier was also contributing to racial disparities in access to kidney treatment, many institutions are now dropping that race factor from their calculations, their eGFR calculations. And I'm very proud to say that the National Kidney Foundation was a leading voice in that advocacy. Next slide, please. We already talked about the fact that kidney disease can be treated. And what you have here is just a graphic showing the stages of kidney disease. It doesn't happen overnight. It happens very slowly, as you've already heard, over many, many years and in various stages. You see here the 5 stages of kidney disease. And, you know, as as shown in this chart, stage 1, you can see includes kidney damage. You can see that the GFR number matches the percent of kidney function. And as you move into those later stages, that GFR number goes down and your kidney function gets worse. And so ideally, people would want to learn that they have kidney disease in one of the first 3 stages so that they can make lifestyle changes to preserve their kidney function. But unfortunately, as we noted in the last slide, many times people don't even learn that they have kidney disease until stage 4 or even stage 5 when it's too late. Next slide, please. Again, what can happen if your kidney disease is not treated? Some people will eventually, as we've said already, progress to kidney failure. And that means that your kidneys are too damaged to function properly. And at this point, you're going to need another medical treatment to survive, which would be dialysis or transplantation, sometimes called kidney replacement therapy. And at the end of this presentation tonight, we're going to have the privilege of hearing from a gentleman who's had a transplant, and he will tell us how his life has changed because of that. Next slide. Again, talking about treatment options for kidney failure. We've already talked about the 2 treatment options, dialysis or transplant. But how many of you actually, we asked this earlier, know someone on dialysis and knew that dialysis was a treatment for kidney disease, right? So there are 2 types. And again, not going to get too technical about it. I know that we've got some medical doctors on here that I'm hoping are putting comments and questions in the chat room that they can address and answer for you in a much better way than I could. But I did want you to know that there are 2 types. Hemodialysis uses a machine outside the body to clean the blood. And this takes place slowly over several hours, and it can be done either at a medical clinic or at a person's home. Peritoneal dialysis is the other type of treatment. And with this type of treatment, a special cleansing fluid is put into the abdomen through a catheter in your stomach. And a membrane or lining of your abdomen acts as a filter to remove that waste, those waste products from your body. And this process, again, can be done at home. It is done at home, and it doesn't always require the use of a machine. Kidney transplant, of course, is a surgical procedure that puts a healthy kidney inside your body. And again, you're going to hear that, see that come to life with our speaker later on. Next slide, please. Again, just talking about organ donation and transplantation. I think not surprisingly to most of you on this presentation tonight are aware that it is much more difficult for persons of African American descent to get a transplant from being on the donor list. And so one of the things that NKF is advancing is living donation. And I think we're going to speak to that again very quickly toward the end of this presentation. Next slide. So we talked a little bit already about social determinants of health. So we know that kidney disease disproportionately impacts some groups, including African Americans, Hispanic and Latino Americans, and as you can see here, American Indians, Asian and Pacific Islanders. And that is because of many environmental and behavioral factors. I think we can suffice to say that it's not so much who you are that determines your predisposition, your risk for CKD, as where you live. Next slide, please. So this slide is just showing the factors that contribute to our health and our risk of premature death. And as you can see here, 70% of the risk for premature death comes from non-genetic factors. And sometimes these non-genetic factors are called social determinants of health. So that's the environment around us, the resources that are available to us, all of which heavily influence our health. Because of structural racism and persistent inequalities in economic well-being, people who identify as Black, Hispanic, or other communities of color are more likely to face the social and environmental challenges that negatively impact our health. Next slide. We can actually go through this one as well. Next slide. So again, what can you do? That's the question. That's the question of the night. We talked about the 33% risk campaign, where you can go in and just a minute or two, figure out what your kidney health status is. Monitoring for diabetes and high blood pressure, which you've already learned are the two leading causes of CKD. And of course, you probably know these things already, but sometimes it's helpful just to be reminded. Healthy eating, a more active lifestyle, and just paying attention, being intentional about your health can help manage CKD. Next slide, please. This one we can go by. Next slide. We just talked about these things: healthy eating, making sure that you vary the type of protein, plant-based proteins that you're eating, keeping sodium down, all of these things, again, that we know, but it's very important to be reminded of. Next slide. So again, this just speaks to various resources that are available to you so that you don't feel that you're alone in this journey, and it is a journey. So you see here some organizations, some resources that are available to you: National Diabetes Prevention Program, smoking cessation resources. There are myriad resources and opportunities in the community to help you manage your health. Next slide. I think we're going to pass through this one. This is just really speaking to the questions that I asked you initially, as we started this conversation, and hopefully now your answers to these questions can come more easily or compel you to want to seek more information. Next slide. I think there's going to be a link in the chat where you can actually take the 33%, the minute, there it is, the minute for your kidneys assessment right now on the spot. You can take out your cell phone, and within a minute or so, you can find out what your kidney health status is, what your risk factors are, and then hopefully take that information and find out how you can make sure that your life can be a little bit healthier. Next slide. Okay, we can pass through this one. And this again, I mentioned to you early on what NKF does, who we are. why we do what we do. And these are just some of the programs that we have to help our patients. If you know someone who has kidney disease, or maybe someone thinking about being a donor, we have a peer mentoring program that can connect individuals with someone who's been through it before. Just again, an abundance of resources that are out there to assist you. So I encourage you to reach out to us, to go to our website at www.kidney.org, and you'll get a lot more information about these kinds of programs. Next slide. We are also, as I talked to you about the change in the EGFR calculations, advocacy is huge in our organization. And of course, as many partners as we have to work together in that makes us even stronger. Next slide. Again, just resources that we provide, including help to our healthcare providers. Next slide. And of course, we're here to help build community. And that's what we're doing here this evening. And again, why we are so grateful for the opportunity to partner with you all in mitigating this disease in our communities. Next slide. I think I'm going to hand this back over to our facilitators. But again, I hope that there was information that caused you to think about your health and those of the health of those people that you love, and how you can help your community make sure that they are educated around CKD and that they're aware of those options, again, to live an optimally healthy life. So thank you all so very much. I have certainly appreciated the opportunity to bring this information to you tonight.
Well, certainly, let me say, Ms. Lorna, on behalf of the brothers, our 2nd District Representative, Brother Delrico Gales, our District Committee Chairman that's here, Dr. Jedan Phillips, I can just hear the applause rolling from coast to coast with the information that you just provided. Simply outstanding, simply amazing. Those of you that have joined us online, I would simply encourage you to put in the chat any questions that you have, whether it's for our ladies from the National Kidney Foundation. Thank you so much for joining us, or our doctors that are here. We want to make sure that everybody understands. Let me go to Dr. Boykin. Any remarks you want to say based upon that outstanding information we just heard from Lorna and the National Kidney Foundation?
Well, thank you very much. It's certainly an exciting and very informative presentation there. I just wanted to bring a couple of points out that she brought up that might want to clarify a little bit more clearly. She mentioned the ACR and the GFR. The ACR was a urine test. And what that test does, I mean, you hear all the times, I got protein in my urine. So this ACR test will tell you about protein in urine. And we use a particular ratio to determine if that is abnormal. So when you go to your doctor, you think getting a urine test is just a simple thing to do, just unnecessary. It's not, because it's a very important test for that particular reason, as well as, looking for, infections and things like that, but also for renal disease. And the other thing she talked about is the GFR. Now, I will tell you, race disparity was a big factor for many years. When you went to the doctor, they had two different types of criteria for the GFR. One was that, if you were non-African American, you had this ratio to worry about. If you're African American, you had that ratio to worry about. But in the long run, it really doesn't make that difference. So in 2021, with the help of the National Kidney Foundation, we redid that whole scale, because now we know that if you're anyone with kidney disease, you have a certain GFR, which GFR just means glomerular filtration rate. I'm sorry. That just means the ability for your kidneys to filter things coming through. And you should have a certain amount of volume going through your kidneys. So if you have an abnormal GFR, that's the first thing you want to worry about. What's causing my kidney flow to be diminished? And by and large, it's going to be vascular disease or injury in most cases. So I'll tell you, from my own personal point of view, for many, many, many years, I had an elevated creatinine. That's the first blood test you see. Creatinine is just another measurement of your kidney function, and it was elevated. And so for many years, they looked at that creatinine with me, and they looked at the old GFR and said, well, you're doing okay, because your GFR, based on the African-American criteria, you're doing fine. When reality is not. When we redid the GFR, and looked at my creatinine and looked at the new GFR, I'm probably in the first stage renal disease. That's very important, because me as a cancer survivor, I have to depend on that for further treatments down the road. So I want to make those 2 points clear, that those 2 tests are very, very, very important. And your doctor needs to understand if they're not using new criteria, they need to be, because it's a much more sensitive indicator of early kidney disease. And again, looking at the urine test for protein will tell you if there's any damage. And there's certain diseases that cause damage to the kidney. A lot of those are autoimmune disease. I won't get into all that right now, but I wanted to bring those points up because that was a very important point that she made during the presentation that we need to pay attention to. You back my time.
No, outstanding, Dr. Boykin. Dr. Phillips, please.
Yeah, great work, Lorna. That presidential Wi-Fi is serious.
Thank you.
Thank you very much for such important information. You know, I think, again, when we look at, unfortunately, a couple of the points that you brought up, it really touches on the blind spots that we have as a community. One being, you know, we're not really great with preventive health. So again, we don't go to the doctor, you know, as we should when we're feeling great, just to get that regular physical or find out if there's some silent things that we need to follow up on. And 2 of the most common conditions that I see as a primary care physician that people don't stay on top of are high blood pressure and diabetes, which are the top 2 causes leading to kidney failure. So I really hope that people are listening and understanding that, number one, you don't have to feel bad on the outside to be having a problem on the inside. And I hope everybody's sitting there saying, do I have a primary care doctor? And if I don't, what do I need to do to make sure that I have someone that I can get this preventive testing done, so that if I do have a problem, even a slight problem, I can begin to work with a doctor to configure a plan of how to address it. But also, and this is the important part where people fall off on, is how to monitor it. Because too many times you see people, I'll talk to them and they'll say, well, yeah, they did tell me I had high blood pressure and I just started eating right. Well, did you go get your blood pressure checked again? I didn't do that. You know, yeah, you know, I did hear that I have pre-diabetes, and you know what? I've been tired a little bit, but it's not too tired where I can't go to work or do what I need to do. That could be worsening pre-diabetes into the diabetic realm, and that could unfortunately, you know, contribute to the development of kidney disease. So again, I really appreciate you mentioning this important information, because sometimes I feel we do have to scare people to make them do the right thing.
Well, I see a question there in the chat. Looks like from Ms. Day Bynum. Dr. Boykin, I don't know, it's close to Virginia. So how would we find out whether a healthcare facility is utilizing the new or old criteria in determining kidney function stage progression? It sounds like she's specifically concerned with the VA hospital.
Well, in this day and time, most of us have access to our medical records and our results. So you will see on that result, if you have say a renal function test. Renal function test is me looking at your electrolytes. It will say on there your EGFR will be -2021. You know that that's the new criteria that they're using. And probably I would say, in my case, it last when I first got into treatment for my cancer, was they were using the old criteria, but they didn't change it recently, and it's just like a lot of things. But you will see on your test printout if you have access to it. If not, just don't be afraid to ask. Remember, medical care is a partnership; it's not a dictatorship. So if you're not sure, you can ask. Are you using new criteria? You know. How does this reflect on me as being an African American? I want to know, because again, as one of my colleagues pointed out in answer to chat, a lot of us were progressing to kidney disease based on information that was racially biased. The earlier you are, as Ms. Hankins said, the earlier you detect disease, the better chance you are of saving your kidneys from further damage. So I just want to say that, and again, as Dr. Isabell pointed out in the chat, as I said, also ask for a printout, and it would definitely say on there, EGFR/2021. It will tell you that you're using new criteria in most cases.
Both doctors, you've already indicated, and I think everybody that we've heard from in this virtual environment, coast to coast, the great information that was shared tonight from the National Kidney Foundation. One of the things, one of the many things that was said, but just one of the things that I think I want to touch on, and it's probably a great segue for us, is, Lorna, you said that obviously we're born with 2 kidneys, and all we need is 1. And so it gets to the point where sometimes those persons in need are in need of a kidney. And so between those persons that have donated kidneys, but I don't think it's often we get a chance to actually hear from a recipient of a kidney donation. And so if he's here, we're gonna take some time to hear from a brother of ours, Brother Rawls, who was a recipient of a kidney donation. And my privilege was that I had an opportunity to talk with this brother before, during, and as we all get the fortunate opportunity to hear from him afterwards, his donation. So Brother Rawls, it's so good to see you again, good brother. How you doing this evening?
I'm doing fine.
Outstanding. Please
Yes.
share with us your experience, good brother.
Well, some of the things that she touched on, when I first started noticing what was wrong with me, I used to walk a lot. And people don't realize that your kidney produce red blood cells. And my blood count was down and I was tired. And so my son said, Dad, why don't you go check this kidney doctor out? And which I did. And that was August of 2019 when I went and checked him out. And when I saw him, he said to me, have you ever thought about someone donating a kidney to you? I said, no, why? He said, well, the way things look for you, you got a lot of juice in your body. That's how you put it. And I laughed about it. I said, yeah, a lot of juice. He said, yeah, you got a lot of juice, meaning that I wasn't getting rid of the water out of my body. So he said, yeah, within about 6 months, may have to put you on dialysis. I said, okay. So lo and behold, on March 25th of 2020, on my birthday, I went on the machine. And the one fortunate thing, I had this drive inside of me that I was going to get a kidney. I was going to get a kidney. I had to make adjustment. From having a kidney and not having a kidney is very, very difficult. You have to alter your whole lifestyle. Every morning at 4:20, I had to wake up Monday, Wednesday, Friday. Monday, Wednesday, Friday. And in the chair at 5:30. And at the beginning, to get these needles hooked up to you, you sat there for 3.5 hours, drawing all the blood out of you. And they told me then that we're only going to clean your blood. We can only clean about 25%, and that's it. So that was a task. But the one fortunate thing for me that I got a chance, and I think you touched on it, although our body has 2 kidneys, but we can work with 1 kidney. So I had a young white fella that I didn't even know who he was. He saw the ad in the paper about a wrestling tournament, and he read it and he says, I'm going to do something for this guy. I'm going to give this guy a kidney, and which he did. So I was on the kidney machine for 1 year and 8 months. So on November the 2nd of 2020, I went into the hospital that morning, 5 o'clock. In that afternoon, at 8 o'clock when I woke up, I had a new kidney, and I always joking, I had a new president on election day. So that was a blessing and a whole. And I want to say something. There's nothing better than not being able to go to the bathroom for 1.5 years because you don't urinate anymore. People don't understand that. And you say, well, then what happened? Well, you go 3 days a week and you get clean, but you don't get clean only 25%. My skin turned dark. I was tired all the time. I couldn't go on vacation unless I set up a clinic to go in and get treatment. So if I went on a weekend, that means I went on Tuesday, I went on Wednesday and Thursday. Then I was off Friday, Monday, and back again on Monday. So that's how it works. So it is a blessing to get a kidney. And I will advise anybody that have high blood pressure, you go see a kidney doctor along with your family physician, but you should get you a kidney specialist because they do this every day and they know what's going on. That would be my advice. And there's, like I'll say again, there's nothing better than having a kidney. Not having one and getting one, I can't tell you how to feel. You would have to experience to know how I feel. So I feel great. I gain weight. I can walk. I can do a whole lot of things. Now, when you're on the machine, you can't eat, believe it or not, tomatoes, too much potassium, potatoes, potassium, peanut butter, can't eat it, can't drink dark sodas. All those little things that you used to do and you can't do anymore. But now I can do them all. So that's my story.
Brother Ross, man, we're just so elated, man, to hear. And obviously, you know, the conversations that you and I have had, but just the ability to share this information. We're just so grateful, man. Thank you for sharing your story. You know, it's just a blessing, man, to be able to see before, you know, during and after. And this is what it's all about. The National Kidney Foundation. This is what the National Kidney Foundation is all about. And so to you, Lorna, and to you, Deanna, and to everybody with the National Kidney Foundation and this partnership that we have with the Omega Psi Phi Fraternity Incorporated, it's just so important. And we just wanted to make sure that everybody was aware. And so with that, Lorna, any comments in response to Brother Rawls' testimony? Just make sure you come off mute so we can hear all the great things you're going to tell us.
How about now? Can you hear me?
There you go. Yep, we can.
I'm so emotional right now after hearing Mr. Rawls' story, and I so appreciate you sharing that. I was looking forward to it after we talked about it before, but I didn't know that it would touch me in the way that it has. And it again points out to me how important these partnerships are in advancing this message about kidney health. Because as I said in the presentation, we are fortunate in that there are things that we can do, you know, to ensure a good life, but it's all predicated on having the information, being educated, in many instances, being bold enough to hold your care providers to your standards and make them answer your questions. And so we're just grateful that we're that partner that can supply you with those questions that you can go in and get answers to and live in a way that you want to, that does not compromise your happiness in any way. So I'm very proud, again, to have been a part of this presentation tonight, and certainly being a part of the great work that the National Kidney Foundation is doing. But I can tell you what we know for sure, that what we do is not going to ensure success if it's isolated, if it's contained within our organization. We are only relevant in that we are giving information to the community that they are embracing, that they're using, and they are empowered by in taking care of themselves and their families. So again, a great privilege. I look forward to more opportunities. I appreciate the doctor's comments. I did tell you I'm not a doctor, so thank you for elucidating some of that information that was shared tonight. But this has just been fantastic all around.
I'd just like to add one thing, brother, before.
Yes, big brother. Yes, big brother. Yes, big brother.
I just want to say that most of us African Americans don't understand that we can live with one kidney. In order to be able to give a kidney, you have to be in excellent health. So that's one way you can find out how healthy you are, because they do not let you come in there if you're not healthy. And this young man that gave me this kidney, he had to sit in the room for 24 hours to take his blood pressure every hour on the hour in a dark room. And he said that he's afraid of being in the dark, but he did this for a complete stranger. And that stranger was me. And we sometimes don't understand that we think that we have, if you give a kidney and something goes wrong, you first on the list to get a kidney. See, that's the other thing that I think that our brothers should understand. All our fraternity brothers, our young brothers, 40 and under, should sign up to give a kidney, to go through the test, because they will make it so much easier for a person like myself. You just don't know. I'm in Tampa, Florida now. I was in Oklahoma a couple weeks ago. I couldn't do this on the machine. I couldn't even come to the conclave unless I set up someplace to go get dialysis during that time. So I just want to add that is, and I want to be able to do this as long as I'm living. You guys can count on me to be a part of this foundation. That's where I'm coming from.
Again, Brother Ross, we appreciate you, man. And I think all of us, even though as men, we may not want to admit it, but I think all of us, during your whole testimony this evening and every time you speak, man, it's just, maybe we shouldn't hold back. Just let the tears flow, man, because this is powerful. This is powerful, and we appreciate you sharing with it. I'm going to put her on the spot. Deanna, I mean, you work for the National Kidney Foundation. Obviously, every time you go to work, you know what the goals are, you know what the missions are. But when you hear a story like this from, Mr. Rawls and other recipients, tell us about how that makes you feel as an employee working for the National Kidney Foundation.
Well, I can tell you I have tears coming down my face listening to it. And I think for me, I've been with the foundation for 11 years, and there has not been a story that hasn't brought me to tears. It doesn't get old. No story is the same. No one's journey is the same, but it is heartbreaking nonetheless to hear what individuals have to go through, and it certainly makes me, as an employee of the foundation, want to do more to get this information into the hands of as many people as possible so that you can take charge of your health, as we spoke about tonight, and you can be your best advocate and hopefully, address these issues early or before they even become issues. But I appreciate, Mr. Rawls, you being willing to share your story with us. I'm so grateful that you are here to share it, and belated happy birthday, as other folks have been saying. So thank you. It's, as I said, I've been with the foundation for 11 years. I've heard many, many stories for our walk program, especially of people who have found their donor and their match at our events. But every story is so unique and so powerful, and just continues to give, me the motivation to continue pushing forward and sharing this information with as many people as possible.
Outstanding. And as we get ready to, it's about that time, and this happens every month. Every month this happens. We get to that point where, unfortunately, we don't have enough cash flow to make the show go longer. But let me say this: as we get to the point where everybody gets to share their closing remarks, as we obviously are here talking about Kidney Awareness Month. So we have enough time for everybody to give probably 1 minute, last minute remarks, and anything that you want to share, anything that you want to make sure that our viewers that are watching, people that are going to watch the recording later, the one takeaway, or anything that you want to make sure people take away from this experience on tonight. So I'm going to start with Lana. You did the presentation. Thank you so much. So if you would, please, 1 minute, give us some closing remarks that you want people to take away from this evening.
Well, I think paramount to me, Mr. Ampofo, is that I want people to understand that there is a level of control that you have. I mean, I think we know that intrinsically. But again, as it relates to kidney disease, there are things that we can do ourselves. You heard about, diet changes, exercising, just being intentional and deliberate about your health care and asking the right questions and feeling empowered that you have that right and you have that power. And so I hope that the information that I shared with you tonight, again, just kind of strengthens you, gives you the tools, the ammunition, if you will, that you need to take control of your health. Because one of the things that resonates with me about the work that we do at the Kidney Foundation is that we are in a space where there is hope. And that is what is important to me, because as you know, we talked about breast cancer, we talked about various cancers. There are all kinds of conditions that don't have this horizon that you can look toward and live a better life. Kidney disease is one of those places where you can control what your life looks like, but it requires early intervention and most certainly education and awareness.
Thank you so much. Let's go to Ms. Deanna, your closing remarks, and thank you so much for being with us this evening.
Thank you again for having us and giving us this wonderful stage to be able to share this information with so many other folks. I think for myself, it is similar to what Lorna said. We work for a foundation where we do, hear the stories, hear the struggles. We certainly talked a lot about the prevention side of this and possibly getting ahead of it by asking the right questions. But I think that it is the hope that we can give to people, that by sharing this information, you can know that no matter what part of your kidney journey you're on, that there is hope, there is help, and there is guidance along the way. We are here to help, certainly. And we hope that, you have taken something this evening that does help you to take that journey and make something of it that's better than perhaps it has been. I also think that for me, what I hope you also took from this evening is the quiz that we shared, where you can get started. Perhaps going directly to your doctor and asking a question is a little intimidating, as it could be for anyone. But if you just take that quiz, if you take that minute for your kidneys quiz and just find out, kind of where, based on your answers, you might land. I ask you all to take a few seconds to take it and share it with a friend. Share it with one person who perhaps wasn't able to be on this or may not see it. And by doing that, we're spreading the awareness, we're spreading the hope, and we're spreading the help. So thank you.
Thank you so much. Let's go to certainly, you've been the talk of the town, Mr. Rawls, on this evening. Let's go to you for your 1 minute closure. You do have one question. Somebody wants to know how young you are. As they said, happy belated birthday. But certainly, Brother Rawls, we'd like to hear your takeaway, 1 minute or less. Brother Rawls.
Okay, I am 76 years old. And at 75, most times they cut it off. It's kind of hard to get a kidney once you pass 75. But my take on everything is some of the things that Mrs. Haskins said about what the kidney do to the body that you don't know about until you get into that situation. Then you find out about it. But my take, what I want to tell everybody, if all the brothers in the fraternity and their cousin or friend would just go out and get on the list to give a kidney, you only need one. And you ask yourself, why did God give us two? Maybe because he knew down the line that one was going to go bad. And you could always, they both go bad at the same time. But a person with two good kidneys can live with one kidney. And I don't know I have one kidney. My body don't know it has one kidney. My creatinine level has been 1.02. That is great. I get blood work done. I used to get it done every month. Now I get it done every week. Then 2 weeks, 3 weeks. Now I get it done every 3 months to find out where my levels are. So I will say, all young brothers, please go out and get on the list to give a kidney and make someone's life as happy as my life. Thank you.
Brother Roz, you making everybody grab those tissues, man. We appreciate you. Thank you so much for sharing your story. Let's go to 78, Dr. Boykin. I mean, I don't know how you follow that up after tonight, but Dr. Boykin, your closing remarks.
Wow, that is a very, very tough act to follow. And I just want to say right now, thank you very much, Big Brother Rawls. I mean, Brother 69, as I'll say, he had a very, very powerful story. There's not a whole lot I can say behind that. I just want to say to people that, ask questions. If you're having some issues, ask questions. Make sure you do your healthy checkups. Do your healthy checkups, and then if you have an issue, follow up. And if you have a question, write them down. So before you get there, you can ask questions about, like, why are my feet swelling? Why do I have this? Know your family history. What are my chances of getting this particular problem, so that you don't forget what you need to get when you go there. So again, as Big Brother Rawls said, live your creed, brothers. Go out and sign up and be a donor. I can't at this point, obviously, but you certainly can. So I hope you come back and take more information as we give it out. And I certainly want to thank the National Kidney Foundation for being with us tonight. And I hope everyone continues to pay attention to this National Kidney Month. Thank you.
Thank you so much, Dr. Boykin. Ladies and gentlemen, last and certainly not least, the Second District Committee Chairman of our Health and Wellness, Dr. Jedan Phillips. Dr. Phillips.
Yes. Firstly, I'd just like to say thank you to the National Kidney Foundation for this informative presentation. This information is critical, again, in line of what we've been talking about monthly, as far as just taking control of your health through prevention. I think this goes right in line with that message. The other thing I would say is kudos to Big Brother Rawls for being brave, because too many times, and I'll say this, not that I have had kidney issues, but I recently had bilateral hip replacements, and so many of us will exist in pain or some type of discomfort because of our concern about the difficulties that we got to go through to get better. And we have just heard a story of someone who has gone through feeling horrible from end-stage kidney disease, and now you would talk to him and you can't even get that feeling that he ever had to deal with something like that. So kudos to him for being brave and going through the challenges and changes in order to get better. And we should all look at him as a model, not only for looking out for our kidneys, but for other ailments that we may have, that because it's not what we want to do, or it's inconvenient, or we're concerned about the difficulties that we got to get through to get to a good place. Again, look at the good place that you can end up if you take these steps to make yourself better. So again, come back and see us at the end of next month. We're on the last Wednesday of each month for this continued preventive medicine message. And Big Brother Rawls, aka 1969, happy born day, sir.
Outstanding. Thank you so much, Dr. Phillips. Well, here it is again, the conclusion of another show. Again, we certainly want to thank our guests from the National Kidney Foundation that have joined us tonight. And certainly it's not just the doctors that you see on the show this evening. We do have doctors that were working behind the scenes. So certainly want to shout out Dr. Isabell, working in the chat room. We've got Dr. Plummer, we've got Dr. Wingate, who's celebrating birthday. And speaking of birthdays, you heard Brother Rawls celebrating a birthday. I want to give a shout out to all the people that are celebrating birthdays this month of March. I think we got some logged in. And so certainly want to salute you as you celebrate another year of life. As we mentioned at the beginning of the show, we certainly want to acknowledge all of our women as part of Women's Appreciation Month. We certainly appreciate all that you do for us. And so we just want to acknowledge you and salute you on your special month of recognition. We talked a lot about kidney awareness. Obviously, also want to let you know, especially the brothers of the Second District, the National Kidney Foundation will be joining us at the Second District Conference. So make sure you take the time to meet with them, talk with them, sign up, and they will be in the house as we celebrate our Second District Conference in Pittsburgh. And so with that, I want to say to everyone, thank you so much for joining us. Again, please share this link with people. Make sure you subscribe. So any updates that we have, you get them right away. I want to thank all of our speakers, all of our presenters on tonight. A special kudos to Brother Rawls for sharing his story. And we're going to find out how we can be a part. As always, as I tell you, please make sure You schedule time to donate blood. We know how critical it is. So please make sure you donate blood. And with that, we'll see you next month. Stay safe and stay well. Brother Kelvin Ampofo, immediate pass, 2nd District Representative. Good night.